Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Let's look at the process of embryo transfer. How do we decide which stage to transfer the embryos in, which day to transfer the embryos in, and what is the process of IVF in general? So very briefly, let's look at the process of IVF or ICSI also, intracytoplasmic sperm injection. In this process, eggs are taken out from your ovaries. It's a very simple process where stimulation is performed, that is, medications are given so that your eggs can be grown inside the ovaries. They are collected from the ovaries and they are cultured in the laboratory. They could either be put in the process of IVF, in vitro fertilization, where the eggs are mixed with your partner's sperms, or there is another process called as ICSI, intracytoplasmic sperm injection, where the egg is held on a special machine and a single sperm is put inside a single egg. Now these are the two kinds of procedures, but ultimately the embryo that is resulting from this both the procedures is your genetic material, your genetic offspring. So after this, the embryos are cultured in the laboratory. Now this is a very important process where the laboratory conditions are maintained, the atmosphere which is conducive, which is important for the embryo to grow and develop properly, are maintained, after which the embryos are transferred into the uterus. So this is in a nutshell the process of IVF. So as I said, we talked about conventional IVF and ICSI, but there is also another process called intrauterine insemination. But this is a process where embryos are not visualized inside the laboratory. The eggs are made to grow inside your body itself, in the ovary, then they are made to rupture, that is, they release from the ovary, they come and wait in the tubes, and it is at this moment that your partner's sperms are processed in the laboratory, and only good sperms, which are motile, morphologically good sperms, are transferred into your uterus. Now this process involves the formation of the embryo inside your body. The embryos are formed and transported inside your uterus and they implant and lead into a pregnancy. However, in conventional IVF and in ICSI, intracytoplasmic sperm injection, the embryo is created in the laboratory. They are observed based on their morphology, their development, their growth timings, and the best looking embryo is selected and transferred into the uterus through the process of embryo transfer. The process of IVF involves embryo culture, which is very importantly done under controlled conditions. So most important factor is that it should be maintained at 37 degrees temperature, and when we culture them, they are transferred into the uterus. Now there may be extra embryos. You may give 8 eggs, out of which you may make about 5 to 6 embryos. All 5 to 6 embryos are not transferred into your uterus. 2 or 3 are transferred based on the quality and the stage of your embryo, and the rest are frozen. So frozen embryos are also competent. They can be removed from this frozen state and used years later for another offspring or for the next cycle if your previous cycle failed. So frozen embryos are also very competent, and the success rate is equal to fresh embryos as well. This is performed at minus 196 degrees temperature. It's not freezing into the refrigerators that we have. It is a special kind of process where the embryos are frozen in time. So how do we decide which stage to transfer? Well, usually embryos are transferred in day 3 or day 5, but mostly now they are transferred in day 5 stage. It also depends on the quality of your embryo. If the embryologist who has done your process and who is assessing your embryos thinks that we will have good number of embryos on day 5, all the embryos are taken to day 5, and from them whichever embryo forms this stage, which is called as blastocyst, few 1 or 2 embryos are selected and transferred into your uterus. The rest are frozen. If the quality is not good or the number of embryos are few, like 1 or 2, it doesn't matter if you take it to day 3 or transfer in day 5. Of course, day 5 is a much advanced stage where we can see if the day 3 embryos did move to day 5, are we transferring good ones? Is there a likelihood of pregnancy from the very few or the bad quality embryos that we have? So it's very good to take all embryos to day 5, select the good looking ones and transfer into your uterus. If you wish to understand more about the process of IVF or wish to get a cycle of IVF done, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.